This is it. We are all going through this sacrifice today to hand this off. This young lady's name is Kimberly, right over here, that is turning in her phone today. And I'm not seeing that there's any kind of emotional trauma on this. How difficult is this for you, Kimberly?
It's not that hard. I feel freer without it.
Why did you decide to do this?
Honestly, yeah, I feel freer without my phone, and then also because of building points, because my building's really competitive. So
I see there. I knew there was a motive behind that. Well, this is what's happening. It's Phone Free Day at Union University. You're seeing events like this all over the country that are going on to really see what it's like. I went through more than 50 years of my life before social media became such a major part of it. But truth be told, you can make it. If I can make it 50 years, some people can make it one day. Although, as Dr. Joanne said to us earlier this week, you'd have to take it out of my cold, dead hand. But these ladies are making sure they're taking the phones, they're taking our IDs here on campus at Union University. They're making sure that we are true to what we pledge we are going to do. So I am going to surrender my phone right now, and it's gone. I'm not getting it back till somewhere around 6 or 6:30 tonight. And see, they're taking pictures of this right here just to make sure that everything is secure, because they don't want to answer my calls during the day, so I had to turn it completely off. So anyway, we're going to bring you a full report next week on Jackson 24/7, just about how everybody reacted to this and how we made it through. Now let's go to Health Hotline with Cole Davis.
If you're one of those people who skips breakfast, you may be doing more damage to your health than you think. Dr. Jill Clark says if you aren't eating a bowl of cereal, you may be paying a price.
If you're watching your weight, you may want to put breakfast foods at the top of your grocery list. A new study shows people who skip the first meal of the day are more likely to be obese than those who eat it frequently. Researchers analyzed the dietary habits of 347 healthy adults 18 to 87 years old. The participants underwent physical exams, and their medical records were reviewed to make sure there were no signs of disease at the start. Measures of height, weight, body mass index, and waist circumference were also obtained. Over 2 or more years, the men and women then filled out questionnaires about their food intake. Those who reported never eating breakfast were more likely to be obese than those who ate breakfast 5 to 7 times a week. Breakfast skippers also reported the greatest weight gain, regardless of age, gender, or body mass index. The authors say these findings involving healthy adults are consistent with previous studies, which identified a link between breakfast consumption and body weight in children and teens.